We understand the need to care for ourselves, and they are youth in these communities. So we are optimistic that despite the challenges that we have, we can work together to solve them. And that is why we are encouraging you to collaborate with us. Yes. That's why we are encouraging you to collaborate with us at OHDI, to work with us. This next slide, the final slide. For young people, we have the One Earth Ambassadors program. There might be people that are registered here. Very soon you'll be getting information on that. We have tools that we develop for youth, for young persons, to communicate AML the right way, to communicate global challenges the right way. You can access them as well. We welcome you to join our networks, to follow us on LinkedIn and some other social media platforms. We also encourage you to volunteer and get involved in our programs. If you know HDI, you will know that we are youth friendly. We work with youth a lot. And for institutions, please, we are willing to work together. One of the tenets of One Earth approach is that we collaborate. We are willing to work with you to address these challenges. So I'm going to give the mic now to the medical officer at OHDI to give an introduction into Rory, one of our digital health solutions. Thank you very much for your time.
Good afternoon, everyone. Next slide, please. My name is Dr. Adigun Olorade. I'm a medical officer. I work with OHDI. And so far, we've been hearing so much about this app. And a lot of people have come to see us at the back, and we've had cause to interact. And this is just going to be a very short explanation or introduction of what we do. So please do not hesitate to come and meet us if you have any other inquiries about what we do. Next slide, please. So I won't read through this, but the general overview of why we created Rore is because we know that there's a lot of misinformation in the system. Like when the pharmacist was asking what people use when they are purging, and people started talking about flagyl. Of course, this information is not something that they learned from the hair. It's what has been passed down from generation to generation. And a lot of information has been and work has been going around about ways to make sure that people don't abuse antibiotics. Unfortunately, it's still an ongoing task. So we have situations where these scenarios are happening. And what do? You're in your house, you need information about your health for your child, for animals. You are wondering what to do next. So that's where our app comes in. Rore, the meaning of Rore is a responsive One Health resource engine, and it's an AI-powered chatbot. Next slide. It's an AI-powered chatbot. It's supposed to provide 24-hour health support for whatever you need across the One Health domain, be it human health, animal health, or environmental health. Currently, it's available on web and WhatsApp, and we're coming up very soon with the app and the USSD. So what we are intending to do, like I said, is provide information for everyone across all the health domain. And we have QR links that you can easily scan. And please, can you show the QR links for people that can come to us? You can easily scan this and start chatting with the bot immediately now. You can ask anything. I'm having leg pain. What do I do? My child is having a headache. What do I do? The essential thing about it is that we are making sure we have programmed that these important symptoms are picked up and we are antimicrobial resistance safe. Our app does not automatically prescribe drugs to people. No, it will redirect you to either the hospitals nearby or you request to speak with a health professional. You have opportunity to speak with doctors, vets, myriad of professionals are available. And we're also looking into logging in health details. We are looking into when you come on the app every day, you tell the app how you're feeling, and we're able to, from there, be abreast of emerging diseases. And of course, we're intending to pass this information to the appropriate authorities. So who does Rore serve? Please keep moving. Who does Rore serve? You and I, livestock owners, crop owners. Yes, it's multi-sectoral. Everybody needs to be on this app because it's useful. You get information that is appropriate as at when due.
Yeah.
Vision ahead, we are, of course, to reduce antibiotic misuse, support climate adaptive health behavior, and of course, we are trying to make sure that this gets to the grassroots because they are the ones that need it. They need to get information at their fingertips so that they can have better health practices for their animals, for their selves, and as well as climate and environmental issues. So please join us. We want to collaborate with you. Engage with us on our social media. Our information is behind the app. And if you have any question at all, don't hesitate to see us. We're available to discuss all with you. Thank you.
Thank you very much. Please a resounding applause for her. Thank you very much, One Health Development Initiative. I love you too. All right, so we're about to have the second panel session. Everybody has stretched, everybody has met new people, but now we want to check the agricultural and veterinary perspective on climate change and antimicrobial resistance. So I will be calling up the panelists, and after that, I will call up the beautiful ladies that will come take the citation while they are up here. So, ladies and gentlemen, with a resounding applause that has energy in it, let's make welcome Dr. Gbolahanmi Oladosu as he comes up the stage. A resounding applause for our father. Can I have a protocol member up here, please? Yeah. All right. Thank you very much. So in that same energy, don't stop clapping. Let's make welcome our beautiful mommy, Professor Victoria Olatunji. Adetunji. Thank you very much, ma, for honoring us with your presence, your ever beautiful presence. Right. Ladies and gentlemen, with a resounding applause, let's make welcome Dr. Babatunde Ogubosi. Thank you very much, sir, for joining us here. Yes, thank you very much. And on my list here, I still have a resounding applause, please. I want this applause to be really special. I had a conversation with Professor Victor when he came into the venue. And honestly, I am uplifted because I had that conversation with him. So a resounding applause like you mean it. Let's make welcome Professor Adetimiri Victor. Please, a resounding applause for him. He's a father, he's a mentor, he's somebody we can look up to, of course. Thank you so much. Good boy. It's in me, take it easy. Got this on cruise to my cheeks. You should go on for the days. Come on for the body, no the breathe. Oh, no, the center, everybody gets Can we have a microphone? If you know the thank you very much. So right about now, I would love to call on Onyebuchi Chantel and the beautiful Aremu Deborah as they come bring the citation of our lovely and intellectual line of speakers here. This is a resounding applause for these beautiful ladies. Joy is come. Only I leave the morning. You Dupa, Olua, yeah. Joy is come. Joy is come. Dupa, Olua, yeah. Joy is come. Only I leave the morning. You up and never. Do what you wanna do.
All right. Good afternoon, ladies and gentlemen. My name is Onyebuchi Chantel, and it's a pleasure to briefly read the biographies of these distinguished panelists that we have before us. So I'll be starting with the biodata of Professor Victor Olawale Adetimiri. Professor Adetimiri holds a 1995 PhD degree in agriculture of the University of Ibadan with specialization in plant breeding. He received advanced professional training in biotechnology from the German Foundation for International Development, Bonn, Germany, in 1996. He was a postdoctoral research fellow at the Yongpyong National University, Daegu, South Korea, from 1998 to 2000, and a visiting scientist at the Institute of Genomic Diversity, Cornell University, Ithaca, New York, USA, from January to November 2024. Professor Adetibiri served as the coordinator of the plant breeding program of the Pan-African University Life and Earth Sciences Institute of the Pan-African University, hosted by the University of Ibadan from 2012 to 2020. Put your hands together, ladies and gentlemen. And he was pioneer director of the Global Affairs and Sustainable Development Institute of the university from October 2018 to June 2019, while he was a visiting scholar at the university. Professor Adetimiri has been involved in collaboration with international partners for the advancement of science and capacity building and has served as consultant to several international organizations. In 2012, Professor Adetimiri received the University of Ibadan Maiden Award for Excellence in Research based on his pioneering super-sweet maize research in West and Central Africa. In 2014, he received the Hitachi UK Japan Eminent Scholars Award for his contributions to education in Nigeria, and he received the Lifetime Achievement Award of the Nigerian Plant Breeders Association. Professor Adetimiri is the current vice president of the Nigerian Plant Breeders Association. Ladies and gentlemen, please put your hands together once more for Professor Victor Adetimiri. Thank you. So the next biography that I'll be reading out is that of Professor Victoria Adetunji. Victoria Adetunji is an antimicrobial resistance laboratory animal health Fleming alumni fellow. She is a professor of veterinary public health and head of Department of Veterinary Public Health and Preventive Medicine, University of Ibadan, Nigeria, where she is responsible for teaching, research, and clinical services. Victoria's main research interests are surveillance for bacterial, zoonotic, foodborne pathogens of animal origin in food processing and environments, and antimicrobial resistance. Sorry, that's antibiotic resistance. In the last 15 years, she has focused on surveillance of bacterial pathogens and antibiotic resistance. Pathogens of interest include E. coli and other serotypes of enterohemorrhagic E. coli and Staphylococcus aureus. She has published over 110 articles in reputable, peer-reviewed international and local journals. Some of these publications have identified circulating sequence types and resistance genes. Her collaborations on AMR research extend to prestigious institutions such as University of Georgia, University of Helsinki, Animal and Plant Health Agency, United Kingdom, and the Federal Institute for Risk Assessment in Berlin. Notably, she recently supervised 2 PhD projects in partnership with scientists from the Federal Institute for Risk Assessment in Berlin and the University of Helsinki. The first focused on the prevalence of methicillin-resistant and methicillin-susceptible Staphylococcus aureus and associated risk factors in southwestern Nigeria. The second, conducted in collaboration with a faculty member from the Department of Food Hygiene and Environmental Health, University of Helsinki, investigated the molecular epidemiology of extended spectrum beta-lactamase producing Escherichia coli in broilers in Ilorin, Kwara State, Nigeria. Finally, she contributed to the development and validation of the National Action Plan 2024 to 2028 on antimicrobial resistance for Nigeria, recently launched in Abuja. Furthermore, she participated in the development of protocols for passive AMR surveillance in the animal sector for Nigeria. This document has recently been validated, and she is involved in advocacy for AMR containment and offered various trainings to pharmacists, private veterinarians, farmers, technologists, and communities focusing on AMR stewardship and capacity for AMR surveillance. Ladies and gentlemen, please put your hands together for Professor Victoria Adetunji.
Good afternoon, everyone. I'll be reading the citation for two of our repeats. Please pay rapt attention as I read and appreciate them. Dr. Babatunde Ogunbosi is a reader and associate professor and consultant pediatrician in the Pediatrics Infectious Disease Unit at the University of Ibadan, as well as the University College Hospital, UCH. He is a fellow of the National Postgraduate Medical College of Nigeria, Faculty of Pediatrics in 2008, and a certified pediatrics infectious disease subspecialist of the Colleges of Medicine of South Africa. He plays active roles in the National HIV, Tuberculosis, Malaria, and Antimicrobial Resistance Program. He is a champion of antimicrobial stewardship and is a research interest in antimicrobial resistance and other infectious disease issues. Let us appreciate Dr. Babatunde Ogunbosi. Thank you. Dr. Gbola Omi Akinola Oladosu. Dr. Gbola Omi Akinola Oladosu is a reader and consultant clinician in the Department of Veterinary Medicine, Faculty of Veterinary Medicine, and Veterinary Teaching Hospital, University of Ibadan, Nigeria. His area of specialization is aquatic animal medicine. Prior to joining the academia in 2011, he had rendered meritorious services as a research scientist at the Nigerian Institute for Oceanography and Marine Research for 22 years. Let us appreciate him. He trained on fish disease control at the State Epizootic Control Service of Lower Saxony, Hanover in Germany in 1991 and in fish husbandry and genetics at the aquaculture unit of the University of Göttingen, Germany in 1997. He has been a consultant to many local and international agencies, such as the Federal Department of Fisheries, Department of Veterinary and Pest Control Services, Fisheries Society of Nigeria, FISON, Shell Petroleum Development Company, SPDC, Nigerian Agip Oil Company, NAOC, Partnership Initiative in the Niger Delta, PIND, United States Agency for International Development, USAID, and United Kingdom Agency for International Development on aquaculture development projects. Dr. Oladosu was the team lead of the aquatic animal group for the National AMR Strategy Development in Nigeria. He is also a part-time lecturer in vaccine production with the Pan-African University in Life and Earth Sciences Institute. He is a fellow of the College of Veterinary Surgery, Nigeria, and presently the head of the Aquatic, Wildlife, and Laboratory Animal Specialty of the College. He has over 50 scientific journals, award-winning conference papers, and technical reports to his credit. Let us appreciate our guests for today, please. Thank you.
All right. Thank you very much, beautiful ladies. Please, a resounding applause as they go back to take their seats. Thank you, Chantel. Thank you, Deborah. Deborah spelled Debra. I just found that out today. Good afternoon, sirs and ma. I am honored again to be here on the panel session. But I would like to welcome the convener for the One Health Summit, the very person of Egbemike Chisom Benedicta, to join me again on this one. So now we are looking at how veterinary medicine and agriculture affects AMR alongside the climate change. Bella, you have the floor in opening
Thank
this
you
one.
very much.
You're welcome.
Amazing host. First off, I would like to thank all our panelists here for not just answering our call to be at this discussion, but for also staying with us to this moment.
Thank you
I know
very
you
much.
all are very busy, you have busy schedules, but you still took the time here, took the time to come here to talk to us, to be with us, to discuss with us. So I'm just really grateful. Please, can we give you a round of applause? Thank you so much for your time. Yes, so I would like to start with Professor Victoria. Yes. So I don't know if I'm not sure a lot of you. I don't know if they read it in the citation, but Professor Victoria was part of the committee or the team that formulated the National Action Plan against antimicrobial resistance 2.0. Yes. So in summary, that's a small thing. People that are on that committee is they're like high level people. So I just want to ask, what was the conversation like at this meeting, formulating this plan? And I know it spans from 2024 to 2028, 4 years. And I know at the resolution there was, create more awareness, improve surveillance on AMR, research. And I know you're a very research-driven person. So concerning research now and concerning antimicrobial resistance, what has the research been saying so far concerning this trend? What's the situation now, and what's it looking like in the next, say, 10, 15 years?
Yeah, let me start with the major focus of the National Action Plan 2.0. We had a National Action Plan 1.0, and then essentially we identified gaps in the 1.0 National Action Plan. We saw the weak areas, which were the environmental sector. There was no provision for proper budgeting in the 1.0. So in the NAP 2.0, we tried filling these gaps, specifically bringing on board the environmental sector, and in particular, even the plant sector were also involved. And then we had specific budgets on this 2.0. Now, on the research platform, there's a national technical working group on AMR. Yes, there's an improvement because Nigeria now has a surveillance protocol. We have priority pathogens. We have SOPs that should standardize the methods we use for AST. However, there's still need for improvement of more data from the environmental sector, because here we're talking about One Health approach to containment of AMR. There's a lot to say in this. Should I go on?
Okay,
Yes.
I think that summarizes it perfectly. But we'll still revisit that question.
Okay.
So
All right, thank you very much, Ma. I would like to direct this question to Dr. Bolahomi Oladusi. All right, so in the general public, right, most times the conversation is always about meat. It's always about the antibiotics itself. People do not understand, I want to believe, the relevance of aquatic animals in the large scheme of things. So I would like you to shed more light on that and emphasizing how often antibiotics are used even in these aquatic animals, so we understand how big this matter still circulates back to us.
Okay, thank you very much. Um, the aquatic animal sector is just developing. It's a fledgling industry. But even with that, the contribution of this sector to the economy of the country is great. And it contributes in very many areas of food security, hunger alleviation, employment generation, and so on and so forth. And you have a lot of people that are involved in this, and we have a lot of resources committed to it. And with that, especially with the adoption of intensive rearing system for fish, which imposes stress on these animals, we have incessant incidents of diseases. Unfortunately, we don't have many trained hands to be able to handle diseases of fish. That's one. We don't have many facilities, health facilities that can handle diseases of fish. So, and when we are talking of climate change, we are talking of increases or decreases in temperature, flooding, and the rest of it. We rear fish in water. And these are warm-blooded animals that their temperature depends on the environmental temperature. So a slight change in the temperature of the environment affects them, imposes stress on them, compromises their immunity. And of course, with increased temperature, you also have increase in the population of pathogens. You have these pathogens getting more resistant and the rest of it. And our farmers who do not have access to primary health care for fish when they have problems will go ahead and help themselves with medicaments that they are not supposed to actually handle. On a survey of an epidemiological survey of diseases of fish, pathogens of fish, in I think around 2010, I was at a farm and I found a heap of the shell of antibiotics on the farm. The content has been emptied into a bucket, mixed with water, and sprayed on fish ponds without any recourse to good diagnosis, without any respect for antibiotic sensitivity, and without any respect for dosage anyway. So definitely you have a problem with antimicrobial resistance. And you cannot blame them because I used to ask, if we have veterinary clinics in all these 774 local governments in this nation, there is no reason why we should not have aquatic health experts in all these places so that people can have access. So you have a misuse or overuse of antibiotics in the aquatic sector, aquatic animal sector. And of course, because people don't also respect withdrawal period. For example, for fish, if you use tetracycline or oxytetracycline, you will wait 21 days before you can sell that fish. Imagine a farmer who runs into problem with the fish almost attaining market size, and he has been treating with antibiotics without any recourse. He will just go ahead and smoke this fish for you without observing the withdrawal period and then sell it to you, and you are buying both the fish and residue of antibiotics. And of course, organisms that are already resistant to antibiotics may also be part of the deal. And these organisms have no, and their genes, they have no respect for any border, whether biological or geographical, or between animals and even humans. So it's a big problem. We have this problem in the aquatic sector, and it's always there. And we hope that we are able to overcome it. Thank you very much.
Thank you very much. Thank you very much, sir. So I'd like to direct my next question to Dr. Gumbasi. Dr. Gumbasi, you have been a pediatrician for decades, so you've seen things come and go. You've seen cases, you've seen individuals, you've seen situations. So I was at an event last year, the WOW Week, World Antimicrobial Awareness Week, and you were speaking about a case that you witnessed in UCH about a child who was multi-drug resistant and who was really sick. So with all this going on, we know AMR is due to, okay, there's some practices we do that predisposes people by, okay, getting drugs indiscriminately, using them anyhow, etc. But like, there's an ideal situation where we say go to the hospital, get yourself checked up, go and see a doctor, get prescriptions. But in Nigeria, that is a very stressful route according to the population, because even the healthcare system, we're not exactly saying the government is at fault. The government has provided healthcare systems, they have put things in place. But the thing is, even at this community level, grassroots level, you still have issue of maybe prolonged waiting time, manner of healthcare workers, etc. So
Customer
people are
service.
like, why should I go through all that stress when I can just cross to the road and buy antibiotics, to buy drugs? So with this situation on ground now, we're bringing it home, we're bringing it to Ibadan. What do you think is the way forward? Because if we keep preaching to people, don't use this indiscriminately, we have to provide a solution for them. So how do you think we can work together to provide that solution?
Thank you for the question and good afternoon, everybody.
Good afternoon,
I'm
sir.
quite excited to be here and I must commend the organizers and I thank my seniors on the floor. I'm particularly excited because we have youth in the house and I see students as well. When I talk about the issue of antimicrobial resistance, I challenge the younger generation because I will not be there when the whole hell gets loose, because that's what we're driving towards if we don't change our ways. And that speaks to the question that you've asked me.
Bless you, sir.
During the World Week that you mentioned, we visited the Deputy Vice Chancellor Academic and he narrated his experience in South Africa. He got there and he had tummy problems and he went to the pharmacy and requested for medications, antibiotics. And the pharmacist just looked at him and thought, I mean, is everything okay? Where's your prescription? And he didn't believe it. Of course, he didn't get the medications until he went to the right place. So what am I saying? What you've narrated is not an excuse. And it's those excuses that has brought us to the place that we are at today. There are no short fixes. There are no shortcuts. We have to learn to do the right thing. Sadly, the so-called quick fix on the long run is actually more expensive. And I've seen that over and over again. Yes, we have challenges. Unfortunately, I would have loved that our country is doing a lot more than we're doing right now. We've been touting and talking about universal health coverage for years, but it's still like a mirage to a lot of people. I've been in the health sector for almost 30 years, and I've never seen it this bad when it comes to manpower shortages. The way our doctors and nurses are leaving the country in droves is disheartening. In the last 5, 10 years, maybe 80% of those that we've trained in the system, they're not in this country. The current crop of doctors, nurses that we're training, if you take a poll, 90% of them are not planning to stay for obvious reasons. So we all need to really speak up and make sure that government does the needful. People have ready access to almost any antibiotics. You talk about the highest class, the meropenems, the vancomycin, the carbapenems, the cephalosporin, ceftriaxone. You can buy almost anything off the counter. There is no nation that can survive with that. So we have to learn to do the right thing the proper way. I mean, I see patients that come to me and they say, oh, just yesterday I saw a patient in clinic. This is a patient from a wealthy family, has had recurrent infections, the child has come with fever, has a cough, has a catarrh, and they're asking which antibiotic should we give? I reviewed the young boy and I said, this boy does not need an antibiotic. The boy is doing well without an antibiotic. And that's not the first. I can give you countless examples, right? But that's a child goes to the community or sees somebody that is peddling drugs. They give them antimalarials, antibiotics, antipyretics, antihistamines, and all of that. We cannot continue to practice or live in such a society.
Yeah.
So my question might not be what the ordinary man wants to hear, but that's the truth. There are no short fixes. We have to fix access to healthcare, and we have to do things properly. If not, we have to pay the dear price for it. And we see it every day, right? A gentleman from our talked about the test result that they tested and they found nothing. Almost every week in my practice, I have to deal with such cases. And not only in children, even in adults.
Yeah.
Sad thing is that the few rescue antibiotics that we have, we don't even have them in country. We don't have them in Nigeria. I've had to look for medications for my patients. I called Pfizer. They looked all over the country. They didn't have. So I'm not painting a gloomy picture.
Yeah.
I'm sharing the reality with us. I've had colleagues come to the hospital with their parents, the father for something else. He picks up a bug on the ward and dies from it. So, like I say, the issue of antimicrobial resistance is both an ethical and a moral issue that we all have a stake in.
Yeah.
And anybody can be a patient. So we have to learn to do the right things. I hope I didn't disappoint you by answer.
You did justice
No,
to
God
it,
is
sir.
true. So please a round of applause. Thank you. I think that's the thank you very much. I think that's the harsh truth that everyone has to face. It's not so comfortable, but we have to do it. It is what it is. But thank you very much, Dr. Ogunbosi, for that.
Yeah, so while he was talking, I can still feel my heart racing. And it's not even in fear, it is in sadness as to how some people actually have to die this cause to actually find like a solution. Like some people's lives will have to like be on the line because these practices have always been, and now we're like there's no quick fix out of it, so now we have to look for sustainable practices. And I think I was having a chat with somebody about this topic, and they were like, most of this research can take up to 10 years sometimes before they can finally find out, okay, this is what works. So I want to direct this next question to Professor Victor. So the urban project explores the use of symbiotics, if I'm correct, like seedlings and stuff on the farmland. Over the years, and I don't know how long that has been, but I would like you to walk us through how this is done, how this innovation comes in line with countering the whole antimicrobial resistance, because the symbiotics are supposed to be organic, right? The microphone is beside you.
Yeah, anyway, thank you. The Urban Project does more than symbiotics.
Okay.
It tries to achieve One Health through the application of agroecological practices.
Okay.
Yes, and it's like a toolbox. It's just that symbiotics is one of them. Um, we're implementing agroecological practices, and we have to find out the ones that are likely to have, the greatest impact in Nigeria, and also on the short and long run, one that is affordable, that
That's
is
beautiful.
easily, implemented at the level of the farmers. So the symbiotics are like combinations of probiotics and prebiotics. Like you have, live organisms in our gut that assist with
Yeah.
digestion and some other stuff. So these are live organisms as well that are able to improve uh, plant growth, development, and sometimes even plant health in terms of uh, resistance to diseases or tolerance to the diseases. So, and I think some farmers in time past, they probably have experimented, with some probiotics from some institutes, but it's possible they didn't get the kind of results they wanted, or
Yes.
yeah, maybe people did not walk through the whole process with them, and then stay long enough for them to jointly evaluate, the effectiveness of the probiotics and then look at it for adoption. So what we are doing right now, and we're getting
Okay.
fantastic results. And we didn't just go to farmers, we started our research in the University of Ibadan. I mean, that is ethical, that we don't take something we're not sure of to farmers, even if we have documentation elsewhere that it worked.
Yes, sir.
So we experimented, and it was the results we got that made us to be enthusiastic about sharing the results with farmers. So right now, in some communities, we are working with farmers, and we are working with them with cucumbers, tomatoes, okra, and one very desperate farmer working on peppers dragged me and said, we must experiment on peppers because it's having problems. Usually when we're working with farmers, we buy their inputs like seeds. He bought his seeds. He was desperate, he needed a solution, and he had seen on some other, one of the farmers we were working with, he had seen that this thing was working with cucumber.
Okay.
So although he was not part of the project, I had to use my position and influence because I saw his enthusiasm, his enthusiasm to say, okay, we'll work with you. So this is how it works. The use of symbiotics. The other part I didn't talk about, there are prebiotics. The prebiotics are like food for the probiotics, so it's the mixture of the probiotics and the prebiotics that make the symbiotics.
Yeah.
So we have incontrovertible evidence of how it improves growth dramatically. I just came back from a project meeting in Cotonou, and our partners could not believe that even in tomatoes, we saw results in 8 days.
Oh, wow. That's
8
impressive.
days, incontrovertible. Unfortunately, I don't have, slides here. In 8 days, that emergence with symbiotics was fast by 8 days. You can see it, so much germination with symbiotics treated compared to the other ones. And then in cucumber, I was shocked. In 2 weeks, we saw improved vigor. Things you will associate with high or fairly high level of inorganic fertilizer application. We didn't apply inorganic fertilizer application. Improved vigor, dramatic improvement. And by 3 weeks, the percentage of tendrils, the tendrils that is structures for climbing, for attaching, the percentage of tendrils, in the symbiotic treated treatments were about 3 times more than the non-treated. And the beauty of what we're doing here is that this is happening on the farmer's field. We're executing it together. We planted together. We go away. They are there. They're going there. They're observing it. And they're excited and elated that this is really working. Now, the implication of all this is that symbiotics alone will not take, the plants through completely in terms of if you want the best of yields. But it has the possibility of even cutting inorganic fertilizers by 50%.
Oh, that's beautiful.
That should be tremendous.
Yeah, please a resounding applause on that one.
That should be tremendous.
At least now we know we are very safe.
If we're talking about greenhouse gases that are produced in the manufacture of inorganic fertilizers and all of that. So if every farmer is able to cut their inorganic fertilizer application by 30 to 50%, that's very dramatic. That's substantial reduction.
Yes.
And by 4 weeks, the same trend we had with tendrils at 3 weeks, the same trend was sustained at 4 weeks in cucumber. A higher percentage were already flowering in treated compared to non-treated. And this is not something you have to convince farmers to accept because they are there.
They are evidence
only
and
there
results.
when we're not there.
Yeah.
They are the ones reporting to us that they want this. Now the question they're asking us is, Prof, how are we going to get this technology? That's the question they're asking right now.
All right.
And so when we got these fantastic results, I started thinking that why should the farmers we're working with be the ones or the only ones, and this is peri-urban farming, be the only ones to be aware of the results we are getting? How about our community? Our charity must begin at home. And one night, I just had this crazy idea that we must distribute seedlings of tomatoes that have been treated in the University of Ghana just one night.
Yeah.
And I shared it with my colleagues.
Yeah.
And they was very enthusiastic. They said, oh, how did you think about that and all of that? And then I started planning. By the next night, I had decided that we should extend it to the Polytechnic Ibadan and the College of Medicine.
I mean, yeah.
And that meant we were going to walk back. Initial plans that I had was that we would give 500 staff of the University of Ibadan 10 siblings each, 250 staff of the Polytechnic, 10 siblings each, and 250 staff of the College of Medicine, 10 siblings free that we have treated. And I do know that tomatoes are costly in the market.
Yes,
so
they
they're
are very
actually
much
speaking to their situation and
Yes.
trying to, so that they can have this at the back of their house. We gave 10 siblings. The 10 siblings can actually meet the tomato needs, if properly taken care of, the tomato needs of a family of 5 or 6 to 8 weeks, that they don't have to buy tomatoes.
Oh,
So
wow.
they take care of it very well.
Thank you very much.
So we started off with the vice chancellor and the principal officers. We didn't give them 10. We gave them bowls containing 150 to 180 seedlings per principal officer.
Oh, wow.
The same thing with the provost and the deputy provost College of Medicine, and the rector and the deputy rector in the Polytechnic. In 8 days, we distributed 16,000 seedlings free to 1,100 people. And people are still asking and saying, can you help us? The funny thing about it is that when we were distributing it, and women and men came and said, when are you going to distribute Rodo seedlings, Rata Rodo?
I mean, pepper too is expensive.
And some other people were asking for. So we are so very excited. It's not like a silver bullet that solves all the problems. You probably are not going to find something that solves all the problem, but we are working with them. We have some other ideas,
Yes.
like they're still spraying, and sometimes you can see that some plants are diseased a little bit, but they don't require spray.
Yeah.
But when they see even the slightest disease, they are rushing to spray, and they will give you reasons why they must spray. So we're still working with them to make them understand that it is not every disease that you spray.
Yes.
And that sometimes the plants have the ability to shake it off or to withstand it, and you're still going to get good yield.
Yeah.
So we're working with them, and we're very hopeful. Actually, we're supposed to do one. We're going to repeat it. We're working with them on daily basis, like 3-4 times a week. We are, on the fields and all of that. So the Symbiotics option is one. We're now looking at how to complement the Symbiotics that is working so very well with some other, strategies or options in the agroecology toolbox, so that ultimately we're reducing inorganic fertilizer application,
Yeah.
we're reducing the spray of chemicals and all of this. That could be drivers, of, AMR in
Yes,
some sense.
Thank you very,
you very
much.
much.
It's a resounding applause.
Thank you.
This panel session is very rich. And when I say rich, it points to sustainable policies, sustainable practices, things that we can actively do. I mean, first we talked about cleanliness and how it plays a long part or a wide part in AMR. But now we have been given on a platter of gold sustainable practices. I mean, from the farm to the fish to public health and even to human medicine. Please, a round of applause for these beautiful panelists here. Thank you so very much for being here and sharing insights with us.
All right,
Arabella.
thank you very much, Oyi. So this question I would like to ask Professor Victoria Aditubi. Yes. So still talking about climate-driven antimicrobial resistance. Emphasis on climate-driven antimicrobial resistance, especially in food systems, because you also research a lot about food, things we take in. So lately, last year we saw some floods. Lately, we've been experiencing some heat waves. I remember there was a particular month this year where the heat was terrible, and it's like nothing we've ever seen before. So, with all these phenomenon happening, heat waves, flooding, affecting human system, affecting livestock, affecting the food chain. So, how do these weather events influence development and spread of antimicrobial resistant pathogens in food producing animals? Like, how does all this work together? All the heat waves, flooding. How does it?
The climate change and the
Yes. How
antimicrobial
does it?
resistance.
Yes. How does it get into? Yes. I just like it.
Okay, let me start with the issue of flooding. I mean, With flooding, you have overflow of water into septic tanks.
Yes.
And so with that, you have contamination of water bodies. You have movement of resistant pathogens and even residues, because there's this issue of open defecation in water bodies. And so you have residues and resistant pathogen spreading to places where they were not initially. And then you have some foodborne pathogen thriving better in warmer temperatures. So that's the way we have this continuous spread. And so there's a weak link here. The weak link is that we don't have strong waste management system where we have effluent water being treated. And so you see farmers using wastes, contaminated wastes with antibiotic resistant pathogens and residues being used to grow plants. And so you have a continuous cycle of continuous contamination from floods and then resistant pathogens and vectors multiplying with increase in temperature. And then when there's dryness, we tend to have scarcity of water.
Yes.
And so the limited water available is contaminated. We did a research on E. coli contamination in milk samples in Kwara State. And we found higher prevalence during the dry season. One would have expected that we should have higher prevalence during the wet season. But we now discover that the processors actually use limited water that is contaminated, to wash their containers. And they also add that to the milk to increase the volume of milk. So that's why the issues of stress and climatic changes affect the persistence and increase in resistant pathogens and residues in the environment. That's one way.
Thank you so much.
Yeah,
Thank you so much. Please, a round of applause
Thank you.
for her.
Yeah.
Thank you. I think okay. Okay.
Something. Thank you very much, Prof. Where we work, the Ajaja River is used for irrigation.
Okay.
We have found very high concentration of Salmonella and E. coli in the samples that we have there. 7.8 times 10 raised to power 5 colony forming units per meal.
Can you see?
It is crazy.
Yes.
That's what we found.
Thank you.
And they use that for irrigation. Let me also tell you that some people that take their produce to Lagos to market, especially Chinese cucumber. The Chinese cucumber is much more expensive. It's crunchy. So they take it to Lagos where you have foreigners and people who really, it's not the regular cucumber.
Yeah.
And they wash it. They wash it with that water that is contaminated with E. coli and Salmonella.
I think this is a good point to talk about ways that we can actually decontaminate the environment,
Okay.
while at the same time adding value and generating funds. And one simple way is actually installing biogas production. Biogas, you need the ingester, which is the ruminal content, the fecal content, the waste from the farms. This can be put into an anaerobic environment where you generate methane. And the waste, which is a slurry, is decontaminated. It's actually the slurry waste that should be used for farm growth and growing of on farms and not the direct effluents. So it's a strong recommendation that even in abattoir settings, we should have the biogas production facility. So the issue of having a refuse dump, high hill dumps in the abattoir shouldn't even be, because we can use this waste to actually generate gas, methane gas, and at the same time while decontaminating the environment because the waste is being used. And as such, the anaerobic environment doesn't allow the survival of this pathogen. It has been shown research-wise that inoculating Salmonella at the beginning of biogas production, they were not able to isolate at the end of production. So the slurry is actually saved to actually fertilize the farms for proper production. Thank you.
Thank you very much, Ma. I love the passion in this conversation. It is really
Sorry, I just
beautiful.
have a follow-up question.
All right.
To the issue of biogas. So this is not my first time hearing about biogas. We've been hearing about it for a couple of years now. But I just want to ask, in how many years do you think you see Nigeria finally adopting biogas, because not a lot of people are they don't welcome change. Not a lot of people welcome change. So yes, there are benefits there. Yes, people probably even know about the benefits. But where do you see Nigeria coming or going in that direction? Like, do you think it's something that in the next few years we're going to see in practice?
Can I comment on that? Now, I was invited for a presentation at the Ministry of Agri in Lagos.
Okay.
And then I discovered that the Lagos state government has actually involved the private personnel into establishing abattoirs. And these private institutions actually have biogas, and they've actually made some money. I mean, they've made profits from the process. And so if Lagos State has already started that and they are recording profit from such endeavor, I think other states should also learn from that. So there's a starting point, but there's a need to shout it out, let people know, let those that have had profits come out and tell what they've passed through and what gains they've made. So we are observing that the private abattoirs are more established, they have better processing facilities, and they also have biogas in place. The Lagos state government has taken a lead on this, and I'm trusting that other state governments will do the same. Thank you.
All right, thank you very much. Thank you, please. A round of applause. Here have plans to, I mean, hearing this from one of our panelists, that okay, this is something that is very, very possible. And this is something you can start. This is something you can get a group of people and think about how you can put these things into place. So thank you very much, Ma, for educating, throwing more light on that. So before I hand over to the host for the day, I just want to ask Dr. Oladosu this question. So I really love the fact that even before you became a lecturer, you had a lot of years on the field. You have a lot of field knowledge, even till now, especially with your business. So you understand the business side of agriculture, but you also understand like the professional aspect as a veterinarian. And the representative of AFAN was supposed to be here because I wanted to ask him this question, but I'll just go ahead and ask. In class, we are being taught that, okay, try to do AST, antimicrobial sensitivity test. Farmers should reduce antibiotics that they use in their feed, that they pump in their animals, and etc. But when we actually try to educate these people, they're like, these are age-old traditions.
Yeah.
These are traditions written, etched in stone.
Yes.
So how exactly can we, because we can't tell them don't use antibiotics. The antibiotics also help increase like weight gain, increases productivity. So if we're telling them don't do this, what can we provide for them? How can we help? How can we come in to say, okay, even if you can't do this,
Like an
you can do
alternative.
this. Okay, increase your biosecurity, etc., etc. But like I just so that it's not like we're telling them don't do this, and they're like, okay, what do you want us to do? So do you get us? I just want you to speak on that for us, sir.
Thank you very much. The point you are trying to make is that are there alternatives
Yes.
to antibiotics? Of course, there are. There are many alternatives that have been from time past, and we still are having many more by innovation that are being introduced. For example, biosecurity measures that could be in place that could help us in the prevention of the incidence of these diseases. You could prevent diseases by management practices. For example, if I will give an example with the aquaculture industry, you could have animals that move from ponds to ponds, like birds, like frogs, like monitor lizard. If they move from a pond that is infected to another one, they spread diseases. But farmers can actually screen their ponds and ensure that you don't have this happening. You can screen your ponds with nets. You can screen your ponds with threads or twine or ropes at the area level so that birds are not able to land. There are a lot of things that can be put in place. You can disinfect your tanks, disinfect your ponds, remove organic material at every cycle of production. So you don't have multiplication of microorganisms. Also, we can vaccinate. Vaccination will also prevent. And then we have people who are making studies and research into phytochemicals, use of plants instead of antibiotics. We are using a lot of, we are having studies in that direction, use of herbs. We are not there yet. We have not finalized on them. And that will mean that we still use antibiotics. We will still have to use antibiotics until we are able to develop these alternative measures. But in the use of antibiotics too, ensure that diagnoses are correct. Let the diagnosis be correct and ensure that the antibiotics that you are about to use is the one that is the choice drug to which the organism that you are trying to attack is susceptible. It's very simple. And then in the use of the antibiotics, ensure that it is used correctly. It's not overused and it's not abused. These are the things that we need to do. And I think we will get there.
Yes, we will. Thank you very much.
Yes,
Okay, yes, Professor Victor.
Oh, she would like to add to that.
Ask Professor Victor.
Okay, brother.
Can the mics be put on, please?
Now I have good news. The good news is that the symbiotics are working with livestock.
Oh, okay.
We have carried out research with pigs and with broiler chickens, and we found lactobacillus, to work very well with chicken. And we had control treatments that we had antibiotics, but the bacillus and the lactobacillus did not receive antibiotics. Okay, for broiler chickens, the lactobacillus was better than both bacillus and the antibiotics that was administered, and also had a low feed conversion ratio, showing that they eat less food to gain the same amount of weight. But what we also found out is that the symbiotics that worked better for broiler chicken is different for pigs. For pigs, it was bacillus. For broiler chicken, it was lactobacillus. So this is really good.
Yes, it is. Thank you
for
very much,
sharing that, sir.
sir.
Well done, sir.
Professor Victoria.
Yes. I just wanted to add the fact that there's a need to explore the use of probiotics in treatment of diseases. In the US, they buy probiotics over the counter to treat specific diseases. And from the experience we've had in our lab, we've actually extracted some metabolites from beneficial organisms like the Lactococcus lactis, Lactobacillus plantarum, and we found them inhibiting most of these microbes, including Listeria. So why don't we explore doing more research in this respect? Because the last workshop we had, it was in an international conference where lessons learned on other panelists. They now wanted to align that with antimicrobial resistance. And I said, we're talking about misuse and abuse. Why are we not exploring the aspect of alternatives? Probiotics. There's need for more research in this area. And we also have these biophages. Biophages control microbial populations. They can even destroy bacteria. Why are we not doing much more research in this regard? So I'm not against the investment of money in awareness and that. But there's a need to improve capacity and put in more funds to research. Exploring probiotics and phages in bacteria control. Thank you.
Thank you very much, Ma.
Thank you very much. So I'm sorry, I just want to ask one final question to Dr. Gumosi, and afterwards we'll throw questions to the audience. So Dr. Gumosi, something struck me. So there's this very interesting thing that is happening. People are returning back to herbal medicine.
Agbo.
Yes, agbo.
For
like we
clarity's
call it.
sake.
How many of you here take agbo?
Let your hand be above your head.
Don't be shy. So
Eh-heh.
the thing now is people are saying, especially communities in Ibadan, they're like most people don't trust the modern medicine made by pharmacy because they believe
Made by
the
white
pharmacy
men.
industry has agenda that they want to. So most people are returning back to local medicine,
Roots.
which are actually quite effective if you look at it. So with the problem of antimicrobial resistance now and these drugs that we have, modern drugs are not working. Do you think we should be looking into that field of, okay, maybe we need to go back to the roots and explore those options that are there readily for us? So what do you think about that, sir?
Thank you for the question. If you look back, most medications actually came from those places,
Yes.
right? But they've gotten to where they are now by research, innovation, and then tweaking them to get something more beneficial and less dangerous. And that's what we need to do. We just can't jump the gun and go back to the herbs and use them the way they are without doing the necessary thing to make them useful.
Civilized from there.
All right. So my take is that Professor Adejuni talked about more research, right? And when you talk about research, it's all about innovation. It's all about getting ideas to do things better. So I believe that there's solutions in those sources that you've talked about, but we need to be sure of what exactly we're patronizing. And that's what's missing in our clients. Somebody just goes to his backyard and he concocts something, and you don't know the side effects, you don't know the problems on the liver, the problems on the kidney.
Yeah.
Some even go the other way and they have a pack that solves diabetes, hypertension, sclerosis, infertility, just name it. What did they do? They had a little bit of antihypertensive, they had a little bit of anti-diabetic drug, and they mix everything together. So when you take it, somehow one of those things will catch your ailment. You understand? And there's no standardization. So I think we need to practice the things that we're talking about the proper way, such that if somebody wants to take this medication, you know exactly what he's taking, you know what the side effects are, you know what it can do and what it cannot do.
Yeah.
Right. So that's the biggest problem in most LMICs, the lack of standardization and evidence base. Prof talked about the probiotics he's using on his farm with his plants. He has evidence. He's put them through the lab.
Yes.
And he can say, if you give this is what you see from so and so. He's also told us that this works in pigs, this does not work in broilers. This is what works in broilers. But do you have all those evidence about the agbo and all the stuff that we're talking about? No. The truth is that a lot of people use all of those medications as a shortcut because of lack of access to healthcare. Some are also entrenched in tradition. And I sit at a place where I've seen what those things have done damage-wise to children, to families, to kidneys, to livers. I just lost, I was with a colleague last week, and she had called me like 2 weeks earlier that her father was ill. They think he has a prostate problem. They didn't know the details, and she wanted me to interact with the professor. And I said, look, he's your teacher. Call him. He will listen to you. And she called him. I said, the man, he's had prostate cancer for some time now. He's disseminated and everything. And I saw her last week. In fact, the day before I saw her, she said she just lost dad yesterday. And I said, oh, God, okay, I'm coming tomorrow. I'll see you. And what was the story? He had prostate cancer. He had complications, went into palliative care. They got him better. and he went home. And lo and behold, he had this nonny or something. She wrote the medication. She told me about it. Without anybody, dad took it, and that was the end. He became unconscious, became oxygen dependent, and he died from just that step of using all these agbo that we talk about. You understand?
Yes.
So they have the benefits, but they're not standardized. They have lots of health risk that we don't know anything about. So we need to be careful the way we patronize them.
Yeah, thank you very much, sir. Thank you so much. I'm sure the research that has gone on, even on those herbal mixtures, were intentional from dosage to specificity with the usage. And now going back to that is like going backwards, like so backward. Thank you so much, sir. Even as the One Health Summit is coming to a close gradually, I want to appreciate this panel session. I want to appreciate everyone on this panel session for their insightful contribution. So back to my audience, do we have a question? I'm taking two questions. Oh,
I'm taking two
all right,
questions.
sir, just two questions.
One more person.
One more person.
Thank you. All right.
Okay.
So please can we get the mic to Dr. Akombi?
Sorry, please tap the mic to them. Thank you very much. All right.
Good afternoon, sirs and Mars
Good
on
afternoon,
the high
sir.
table. Thank you, the audience. Thank you for a robust time and engaging discussion. I'd like to quickly give a little background of what I want to talk about. We have a lot of issues concerning AMR in our hands. Let me quickly, for perspective, let me introduce myself. I work as a meat inspector at the abattoir for 19 years, and I've seen a lot of things. And we've had a lot of advocacies, enlightenment, awareness campaigns for different people, especially in the livestock value chain. And I'd like to ask Professor Adetuji a question, but let me quickly run the background. I remember that I think we have a publication together, about 13 years ago, where we sampled 90 meat randomly on the abattoir floor, and 100% had antimicrobial residues, and that was oxytetracyclines and penicillin Gs. And over the years, we've done, and time again, you can be sure that all of us are involved in this issue, and we are being exposed to little doses of antibiotics every day, especially if you eat meat or you eat eggs or their products. So my question to you, Prof, is this. The last advocacy and enlightenment campaign we had with farmers and other stakeholders, I was asked a question, but I was in a fix. I was asked that, I told them that once they give antibiotics to their chickens, especially the commercial layers, they should not sell out immediately until they observe the withdrawal period for the drug. But somebody told me that he has 30,000 layers. So on the average, maybe like 25,000 eggs every day. So is he supposed to break all the crates of eggs, hundreds of crates before the withdrawal period? I didn't quite know what to say. And so that's it. Then again, in the abattoir, for example, in Ibadan, we slaughter about 1,000 cattle every day. And those cattle, when they are slaughtered, most of them are injected. As I speak to you, in fact, I have a lot of videos on my phone, pictures. You see quacks, you see people from the northern extraction just giving antibiotics anyhow to their animals to trade animals. And they will just give the antibiotics and slaughter the same day. Sometimes even in meat, if you can perceive the smell of antibiotics. So when they slaughter the animals, most of those drugs are not metabolized. They're in the blood, they're in the urine. Can you imagine the urine of 1,000 animals every day? And so when they open the urine to the environment, they contain not non-metabolized or not completely metabolized drugs, depending on the kidney function and all of that of the animals and their bile. So they go into the water bodies. I've done a study, even I went to rural areas if I could get a better result. And I tested the water, well water. All of them, all the water samples had antibiotics. And we are drinking them. So if you drink water, I mean, and some of them even use them for pure water and bottled water. If you drink those water, you are probably taking low doses of antibiotics. So, and then they are in the environment. You know, the blood goes to the environment, gets to the water body, gets into surface water, into deep water. I even tried this deep water, you know, this one that they pump manually. I got the water, I found antibiotics residues there. So how do we, so it goes beyond what we think. I have so much more to say, but I don't want to take much time. So, but how do we tackle this? How do I advise them? How do I tell them what to do with their animals? There's someone that came to see me yesterday. She's trying to provide organic food, organic meat for people for human consumption, and she said that somebody told her that from Lagos that she would really appreciate if she would have meat that are not containing antibiotics residues. And then, because the person is sick and she needed to eat organic products. So, and there's no way I can guarantee that for her. So how do we tackle this? Thank you very much.
Thank you very much, sir. The resounding applause for him. Thank you, said Professor Victoria.
It's a big problem on our hands.
Very much.
Yes. And it's the same scenario, even the Deho chick markets. You see the Deho chick marketers administering gentamicin to prevent infection. So I will try to start from what we can do. We can continue to do awareness campaign. Yes, educating them. Sometimes some of them don't really understand the implication of what they are doing. Like some years back, we did some work in the abattoir setting. We collected urine samples from abattoir workers, and we're actually trying to isolate E. coli 01557 that can cause kidney failure. You wouldn't believe, within 2 months, we're able to isolate E. coli 01557 from 2 of the abattoir workers. And by the time we went back to give them a feedback, 1 of them had died of kidney failure. Now, giving back feedback from what our research findings could be a way of educating them that this problem is actually with us. The sources of antimicrobials, we say we are finding antimicrobials in our rivers. I must confess, we found it in Eleyele River here. Yes, we found tetracycline. And for many years, I didn't publish that work because I didn't understand why tetracycline residues should be in Eleyele River. But now I understand better. When we do research with antimicrobials in our laboratories, how do we discard it? We inject antimicrobials into sentinel animals. How are these animals discarded after euthanizing them? We have this issue of open defecation. Of course, residues and resistant pathogens, and then waste from pharmaceutical has also been discussed. Now, we need the government buy-in. We can't do this all alone. Like I had the experience with the Animal and Plant Health Agency in the UK. They do continuous surveillance of residues and resistant pathogens in meat samples. I mean, they just go to the outlets and buy the meat samples. Now, for the farmer that has, you mentioned 30,000 flock size. I mean, if he discards the whole of that flock size, who compensates him?
Exactly.
We really need the buy-in of the government to make things work. I mean, the issue of policy, we find a lot in the labs. How do we translate this to policy so that the government knows the importance of this? We need to shout more, make a lot of noise, do more campaign and awareness. Because the Fulani man who has injected tetracycline may even sell a dead, that happens. Dead carcasses. Yes, they do sell that. But who compensates him? It will be difficult without the government buy-in. And that's why we're saying Fleming is supporting AMR surveillance in Nigeria, capacity building and resources. What are we thinking as a country? What are we going to do for ourselves when these funds are no more there? So we need to actually, the government will need to devote some funds to actually contain AMR to the local level, to the local farmer, because that's his livelihood. And so if he has a disease outbreak, he has treated animals, he needs somebody to give him something to compensate for him to do the right. So we are talking about the issue of economic value now. So we can't underplay that. So we can't totally erode this scenario if we don't have compensation in place. Thank you.
Thank you very much, Ma. Thank you very much, Ma.
Okay, so we'll take Adebayo and we'll just.
He has. Can we get the mic to him, please?
Meanwhile, please, can we have the plaques sent?
The award's ready.
Can we have the plaques for the panelists?
It's gonna have a microphone too.
Okay. Good. Good day, sirs. Good day, ma. So, this topic on antimicrobial resistance and climate change, there is an important aspect of solving the problem that I think was not part of the discussion so far, and I would like to bring to our attention, and I will ask my question from there. The aspect of collaboration. The aspect of collaboration, yes. So it's like we know it's a multi-sectoral approach to solving this problem.
Yes.
We've been talking about these farmers, taking drugs and all of that, but we didn't think about how do they have easy access to these drugs. Do you understand? Then, Prof, I'm sorry, sir, I didn't catch your name. Concerning the aquatic specialists,
yes,
we know they are very scarce. But then these farmers have easy access to the pharmacy to just get these drugs and all of that. Is there a form of collaboration? How can we collaborate with pharmacists or at least with these drug sellers? How can we educate them more, on these things that we, as a pharmacist, we are not taught much on.
Yes. The question is to him, right?
Yes. So we are not taught much on veterinary medicine, although we do a little bit of that and all of that. But these guys come to us.
Yes.
When we don't have any answer to them, we just give them whatever they want since it's not our field. Do you understand? So is there a system in place for multi-sectoral collaboration, not just with pharmacists, but even with the patent medicine vendor, even with the traditional drug producers that doctor talked about, and with all other fields? This is something we need to really talk about. Thank you very much.
Thank you very much.
So we'll take Professor Dr. Oladusi, and then we'll take Dr. Ogunbosi. You'd like to.
Okay, sorry. I was speaking with Professor Adetunji, and we looked at the hall, and we thought that it should be full to the end. I know it's taken a lot to put this together, yes, but I'd have loved to see a very rich blend and participation of students here. So we need to speak across boundaries. I've been fortunate to lead we have what we call the CW PALMS in usage. That's Commonwealth Partnership for Antimicrobial Stewardship. And we've had activities 2023, 2024, and even up till now. And that's when I first met Professor Adetunji. That's when I first met Benedicta. In 2023, we had a One Health Student Symposium hosted by the students, guided by the mentors. And we had students from many departments: pharmacy, surgery, medicine, animal science, food science, just name it. After that, they've gone ahead to establish a Student One Health Club. And I thought that they should also be here this morning. In that same activity, we had engagements with community pharmacists. We had a workshop with community pharmacists. I've worked with environmental scientists, environmental health scientists. One Health is the solution to antimicrobial resistance. At the national level, there's been some effort. The National Antimicrobial Resistance Response, domiciled in the NCDC, actually has a tripartite, actually now quadripartite body contributing to it. And the National Action Plan that Professor Adetunji also alluded to is actually a One Health National Action Plan, because we had input from human health, animal health, environmental health, And I think maybe food sciences were also involved. Of course, was also a costed One Health. And there was also a revision to the pillars of the National Action Plan. Before we had just 5 pillars: awareness, surveillance, infection prevention and control, antibiotics access and stewardship, and then research. And then they've added governance. So that governance is supposed to bring all the necessary parties together to be sure that we have a coordinated and multidisciplinary approach to all of this. So to answer your question, I think it lies with all of us. It lies with all of us. How do we go about our activities? How do we go about our research? How do we go about our engagements? In the antimicrobial stewardship team in UCH, it's multidisciplinary. We have doctors, we have lab scientists, we have pharmacists, we have nurses, we have IT, we have admin people, right, engaged in all of that, because all of us have a role to play. So I'm quite excited to see students putting this up. I'm also excited to see students in secondary school in this hall. And the whole idea of the One Health Club was to make sure that students begin to speak to each other as students, begin to form collaborations as students, such that when they go ahead and become researchers, they will not work in silos, they'll work together.
Yes.
So I'm hoping that the students in this hall will also take away that message, that together everybody achieves much. Thank you.
Thank you very much, sir.
Thank you, and thanks for your question. The major problem is not access to antibiotics. In fact, the problem for AMR is easy access to antibiotics. When farmers have problems and they can reach out and be able to get the antibiotics to use, they will use it without recourse to diagnosis.
Yes.
They will misuse and they will overuse. While it is important that with the One Health thing, we all collaborate. That's very important. There is no question about that. But, you know, it's not only about having access to the antibiotics. How will you use it? Let me give an example. A fish farmer has a problem and he needs to use antibiotics. He needs to know how to use that antibiotics. There are ways in which we apply antibiotics to fish. Is either you use it as a bath method. You put antibiotics in water, you put the fish. And of course, you cannot put antibiotics in ponds because there will be the problem of disposing the water.
Yes.
The water goes into the environment and it creates problems.
Back.
Or you apply the antibiotics in their diet. And if you need to do that, there is a way to do it correctly. If you do it incorrectly, you will still come back to the same problem. And if I ask a farmer, go to a pharmacist, that means I'm asking him to go and have easy access. When he gets there, he buys. How he will use it becomes a problem. These are the things that we have to overcome.
Yeah.
I don't know whether you understand me.
Yes.
These are problems that are in place that we will have to overcome to be able to ensure that we don't continue to have that problem.
All right, thank you so much, sir. Please, right after now, if we have further questions, because I am still going to meet with some of them after now. I've been so blessed from their wealth of knowledge. So if you have further questions that you'd love to ask, we'd like that you pen it down and we'll get you direct medium access to get across to them and have the conversations with them. Please do not double cross them, so to say. They are right mediums to actually reach out to them. I will make that available to you. So thank you very much.
Please, can we give them a resounding round of applause? Thank you so much for your time. Thank you for your wisdom. Thank you for being here. Thank you for your presence. And as we're talking of appreciation, we just want to thank you. You've done so much for us. We can't repay you for that, but please just accept our small token. I'd like to call the vice convener, George Ibe, to please be on stage with me. Dr. Akombi, please, if you could join me on stage to present this award. Architect Tosin, if you could join me on stage to present this award. A representative of OHDI, please, if you can join me on stage to present this award, I would really appreciate it. OHDI, I can see they're quite busy. All right. So for the first, from there. Okay, thank you. So we're going to be presenting this award of appreciation. And Dr. Akombi, please, if you could present this to our panelists, I'd be so grateful.
Oh my God, it's Jenny K. Silva.
Dr. Oladoshu, would you please step forward, sir? So this is the award of appreciation presented to Dr. Bolaomi A. Oladoshu, panelist, for your unwavering commitment to fighting against antimicrobial resistance and climate change. Your thoughtful contributions helped drive meaningful dialogue at the intersection of health, environment, agriculture, and policy. Congratulations, sir.
It's lonely at the top. Lonely. Money on my mind.
For the next award, I respectfully call forward Dr. Babatunde Ogunbosi. I present this award to you this day, the award of appreciation presented to Dr. Babatunde Ogunbosi, panelist, for your unwavering commitment to fighting against antimicrobial resistance and climate change. Your thoughtful contribution helped drive meaningful dialogue at the intersection of health, environment. Congratulations, sir.
Yeah, what they yarning about me in particular. Call me. Out here on you, don't chasing my dream because I know what chasing for me. Oh, la, 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 they can't bump my love.
Thank you very much, sir. And this next set of awards, we'd like architect Tosin Bimuli on behalf of Imprexy.
With honor, I call Professor Victoria O. Adetunji, panelist, for your unwavering commitment in fighting against antimicrobial resistance and climate change. Your thoughtful contributions helped drive meaningful dialogue at the intersection of health, environment, agriculture, and policy. With great honor, ma.
All right, thank you very much. Please, a round of applause as Architect Tosin takes his seat. This last award is going to be presented by Damilola Adesi on behalf of OHDI. So please.
Thank you. The award of appreciation is presented to Prof. Victor Adetimiri for your unwavering commitment in fighting against antimicrobial resistance and climate change. Your thoughtful contributions help drive meaningful dialogue at the intersection of health, environment, and agriculture. Congratulations, sir.
Without doctor's prescription, all on doctor's attention. If you need solution,
Okay, I'm going to be presenting this award of appreciation to Ms. Sharon Oyilayo. Please, can you give her a round of applause as she joins us on stage?
Thank you very much.
We'd like to thank you so much for your unwavering commitment in fighting against AMR and climate change. Your thoughtful contributions to this event has helped drive meaningful conversations around the theme for the day at the intersection of health, environment, agriculture, and policy. Thank you so much for your time. Please, can we give her a round of applause? Church, please join
all on doctor's attention. If you need solution.
So, we're going to be presenting an award of
Please, before we all go down, please, can we have a group picture together?
Okay, yeah.
Can I have Bella on the other end? Okay. Please join us upstage. Thank you very much. Please, a resounding applause for them as they go to guest seats. Thank you so very much. We appreciate you. All right, so we're moving now to the next category of awards. We have a collaborating organization for the One Health Summit. Please, a resounding applause for the Antimicrobial Resistant Club from the University of Ibadan, ably represented by Hamza Abdul-Basit. Please, a resounding applause for him as he comes up to take their award. Thank you for collaborating with our cause.
Smile is as bright as the light in the shoe. Please keep clapping for the president of AMR Club. Please keep clapping for him. Thank you so much for collaborating with us to make this event a reality.
I know the waste time, okay, make I just go straight. 1 out plus 1 out equals to 2 bone straight. No long talk, send advance, go my one pay. 50-50, all of us go day okay. 3 months so start to give me space. Money not day, your serious big go big place. I don't know why you dey always dey feel say you dey important, but they go still replace you. Now scratch. Carry the money, drink cash.
All right, so Bella, I want you to do justice.
Okay, this award of appreciation is presented in absentia to Professor S.I.B. Cadmus in recognition for his contribution as a keynote speaker. So I'd like the representative of Damien Foundation Microbacterial Center to please receive this award on his behalf. Please give him a round of applause on behalf.
Angeli, come and lay me. Obìnrin tó bá fẹ́ me, consider lucky. My baby, let's keep on jamming.
Okay, now. Yes.
Fire cannot cool down if you dare me to snore me.
Sure. Okay.
Body shallow, my baby.
Be careful, let's go.
Okay. So over the breakout session, you're not coming up now. Over the breakout session, we had the prototype exhibition. And for this award category, Imprexy will be coming up to present the award. But before we get that, do we have it ready now? Do we have it ready? Sorry. Do you have the award? His names. All right, please. A resounding applause for him as he comes up. Should we stop clapping really? Please, a resounding applause for him as he comes up.
Thank you very much. Good afternoon, ladies and gentlemen. Good afternoon, distinguished guests and speakers. So I'm here to announce the winners of the competition. So we have assessed and we have gone through all the entries, and I must say they've all done really well. They all have innovative ideas. Can we give a round of applause to them? So there were myriads of entries, but these 3 were shortlisted. Can we give a round of applause for them, please? All right, so they were all assessed based on 5 major criteria. The first is innovation and originality. The second is scientific merit and feasibility. The third is sustainability and long-term impact. The fourth is measurable impact and scalability. While the fifth is collaboration and stakeholder engagement. And altogether, they have 100 points. So with 73 points, the 3rd position goes to Waterbrooks Technologies. Can we put our hands together for them? Then with 80 points, the 2nd position goes to Pharmabean. Can we put our hands together for them? And then with 83 points, the 1st position goes to EcoBag. Can we put our hands together for them?
Original talent will be piracy. If I keep quiet, tell me. Ojuri kala demi to dele, kisuru mi to lere. I keep going on Saturday. Are you there? Are you there? Aluwe, Ewawo, Otolo. Are you there? Are you there? Aluwe. Ará àdúgbò tó pàdé mi lọ́nà. Ará àdúgbò tó pàdé mi lọ́nà.
Please, can we have the representative for this prototype exhibition? For the three categories, please, can you join him up the stage? Please, a resounding applause for them as they take the stage. Please, a resounding applause. It took time, it took energy, and now it's paying off. So please, a resounding applause. Let's appreciate them as they go up the stage. Okay. All right, let's do something. When you guys get up there, you guys are dancing towards him. I don't know how you want to do it, but you have to invite the dance moves already. Keep going. You can dance your way there.
No one that name them go call mine. I said they shut it down now. Tuesday, Wednesday, Slongest night, Jalaba. And they call me the Godfather. Move like an Italian. Have you ever seen a nigga like moi? Each and every lady wanna give me mwah.
Please, can we have the three categories up? The first, second, and the third. Thank you. DJ, please let the winner down. Thank you very much.
I know two pass in Solomon. I get high, you know like me, what do you want? My guys, what happened? My guys don't follow no. With the skies start falling down. I'm still your daddy.
Thank you very much. And a round of applause for her. And now the summer demonstration. Now the first answer. And walking away with a sum of 150,000 naira.
I'm a fire, no be peace, no come back.
Thank you so much.
Anywhere we are doing a fire.
To the last category session, award category session that we have, the one for the essay competition. Please, do we have the award ready and the name of the awardee ready?
Follow Judy, party, jolly, party, with the body, shots curry, we cry then. From now till
We have the name for the awardee ready. So we getting their award, okay, so we getting their gift right after now. So ladies and gentlemen, we are gradually coming to a close. And the first edition of the One Health Summit is nothing but a success. And we could not have amounted to such achievement if not for you being present here today. So please, a resounding applause for yourselves. All right. So as much as we're here for a cause, somebody brought up this initiative. Somebody had this idea that brought everybody together. And please, 1 second. All right, sorry about that. And right about now, I want everybody with a standing ovation. I am sorry, but we are going to do that because I believe it takes more than just words to pull this kind of event together. So with a resounding applause and a standing ovation, let's make welcome the convener as she's been awarded for the success of the first edition of the One Health Summit, the very person of Wemike Chisom Benedicta. Please, a resounding applause with the energy And I'd like the deputy convener to come and present this beautiful award to her. Don't stop clapping. Come on. Now we're going to do this. Go Bella, go Bella, go. Say go Bella, go Bella, go. All right. Very much, ladies and gentlemen, you may have your seat as the deputy convener takes the mic. Yeah,
it's working. Okay, so this award of honor is presented to Igwemike Chisom Benedicta,
That's me.
the OHS convener,
That's me.
in recognition for your visionary leadership
That's me.
and
And
unwavering
clap, oh,
commitment
clap. Thank you.
as convener of the One Health Summit 2025. Your efforts have fostered collaboration across disciplines, driving impactful conversations for a healthier and sustainable future. Congratulations, Igwemike Chisom.
An award well deserved.
Blessings upon my life till they see me for Valhalla. Mama say make I listen to Jah, make I no reason to fall. Man, I been living too fast, make I dey chill and relax. Life has been good to me, I do not take this with levity. Nothing is new to me, but lucky I'm grateful for everything. The good and the bad and the ugly, all of the joy and the suffering. And then it dawned on me, all that I seek is in front of me. Isha Oluwa ko seni to ye, bí mo ṣe ṣe mi ò mọ̀. I just stay on my grind every day, I keep my eyes looking up.
Thank you very much.
Don't leave
me. Sorry, my you can go. But you, sir, you have to stay with me. All right, so thank you very much. I'm so happy that we finally come to the end of the first edition of the One Health Summit. And if there's anything I learned here today, is the fact that the change starts with us. It is not enough that we shout about it, that we talk about it. We have to put all hands on deck, because that's when that ripple effect of a team, of the unity that we clamor, even in this antimicrobial resistance awareness, can go far and wide. So, ladies and gentlemen, I'm super excited to have served as your compare for today. My name is Onyidamola Omobaba Fawemi, but you can call me Onyidamola Fawemi. And I am super happy that everybody here has been impactfully packed. I mean, there's space for more, but first we're going out there to execute that which we have learned here today. So until my next event where I get to see your beautiful faces, I remain your host with the golden voice. So now the deputy convener can have the stage while he gives the vote of thanks. Thank you very much, everyone, and enjoy.
Yeah. Don't sleep, wake up. Collect your money, wake up. Collect your money, wake up.
Hi, everyone. Thank you for your patience so far. I'm the deputy convener. I'm George Ibe. And before I give my vote of thanks, we want to do a survey to understand how far we have learned, what we have learned so far at this event. So please scan the QR code. And if you can't, there's a short link. So just type it out. Please would appreciate if you participate in this survey. It can help future summits and future policy making. So please, the link is a questionnaire, and there are questions there that would help us to understand what you have learned so far. Thank you so much for your participation. So first of all, I would like to give thanks to God for helping us put this event together. It has been a whole lot, but we thank God that we're able to pull this through. Secondly, I would like to say a very big congratulations to the convener of this summit. The summit was a success. The summit is a success. So a very big congratulations to the convener. I'd also like to say a big thank you to our panelists. The panel session was very, very educative. So thank you so much to our panelists for so much knowledge that you're able to pass to us. Thank you so much to our panelists. Then to our special guest, thank you so much for gracing this event. We say a very big thank you to you. To our sponsors, thank you so much to our sponsors. Without you, we could not have done this. Thank you so much. To the partners, the student associations and other partners, thank you very much. To the team members, it has been a whole lot. For months now, we have been planning this, and today we have pulled it off. Thank you so much to every team member, every volunteer here today. Thank you so much. Thank you so much. And to the students and the attendees, this summit cannot happen without you. We really appreciate your patience. We really appreciate your presence here. Thank you very much. Thank you very much to everyone here, and we'll meet again. Thank you.
Modernization, chicken from money pressure, street orientation. Modernization, from money pressure. All my niggas sharp proper. All my niggas sharp proper. Cover face like badger. Get feel like but we know they cut. TikTok boys them tap tap tap. Pass for the shit rababa. Oh my ego rababa. Feeling good banana. Music don't need permission to enter your spirit. Anyway, anyhow, say you go feel me. Music don't need permission to enter your spirit. Yeah. Anyway, anyhow, say you go feel me.
Awilo lukumba, ebuchika tokawa, wabad ni kiwaba, a living like no other. Ewanya na kwaju, nyapi topa walibe. I don't need talk and you go no feeling good parana. Chasing on your punch.
Yes, sir. Modernization, chicken from money pressure, street orientation. Modernization, from money pressure. All my niggas sharp proper.